These meetings were quite high-level, policy-level workshops, so attended by top leaders in global health. So the discussion points were around strategic, policy making, planning, and implementation level in different health topics.
Typically, you have professionals in different countries working in silos. It was good to see that an Academy of Medical Sciences had professionals who were beyond the typical medical sciences.
And the opportunity to work with stakeholders in different countries, particularly other academics, but other fellows of other academies, and to hear what their needs and hopes and aspirations are for research. And most of all, to learn from them. I mean, they have the questions to which research can give the answers.
I like the diversity of the workshop. It was both a north-south diversity, but it was also a mix of very senior researchers and academics, mid-career, early career people from all over the world. And I thought that was a really great approach to get that kind of diversity of viewpoint, and it was also a good gender balance.
Professionally, I had the opportunity during the workshop to interact not just with the individuals who were organizing it and those who were on the steering committee, but the workshop implementation itself created space for a lot of other people to come to the table, to bring things to the table.
There's the networking, and then there's the peer-to-peer exchange of knowledge and learning, and then there's also the capacity building.
And then, of course, we've built good relations with some of the co-chairs that we have nominated to these projects and with their academies. So building teams not just between Trieste and London, but also with other academies that have been involved.
Providing the basis for the advice that we are giving to the different levels of government in our country.
I think which is always good for members to feel engaged with an organization, that they can see opportunities to engage and concrete results coming out. So I think this has been very positive.
Research funding agencies, particularly in the UK, but across the globe, are increasingly using a multi-morbidity lens to craft their request for proposals. So I think that is definitely a huge impact.
The workshops have helped our research commissioning be better informed and fairer.
The main product of this directly from the UK side was the report, which on multimorbidity, which was just, I think it's really very novel, innovative, path-breaking report. I think it's influenced the way individuals think about their own research, which was previously done very much in silos.
The greatest benefit that's been realised so far, I think, has been engagement of many different people in the understanding of how some funders, particularly the Medical Research Council, but also the Wellcome Trust and other funders, want to engage with local expertise in developing their research proposals.
What I do think will happen is that it will not only influence health itself, health outcomes, but it will influence health policy.
The engagement for me and for us, in country, is something that we'll cherish beyond that meeting.
What I would like to see personally is to see some of the outputs of these workshops travel. So I fully recognise that there are regional or local specifics to research needs and challenges. But I think much learning could be across settings and be enhanced by considering context-specific issues in other contexts.
Each of the topics that was covered in these workshops is still very relevant, and it's still important for us to keep them in the public eye, in the eye of the international organizations and the countries where they're very relevant. So we take whatever opportunity we can find to resubmit and repropose the recommendations that have been made.
I think clearly that the Academy's work is stimulating, strong conversations, stirring up thought leaders, bringing in people who really want to discuss issues that are important to countries from an independent perspective.
It's had an impact, I would say, on the funders, and it's also had an impact on the researchers. And what I'm hoping, because that's what I really care about, that as a result of this evidence that will be generated, that it will have an impact on the policymakers.